implementing vaping prevention in our communities. This is part 2 of the webinar series aimed at highlighting the Health Promotion Initiative, Not an Experiment. We will begin with our land acknowledgement.
The Simcoe-Muskoka District Health Unit covers a large geographical area extending from South Simcoe up to Muskoka. This is the area where we live and work. We would like to acknowledge that the land that we are gathered on today is the traditional territory of the Anishinaabe Nation, specifically the Chippewa Tri-Council, comprised of the Chippewas of Beausoleil, Brahma, and Georgina Island First Nations. We also acknowledge the Potawatomi of Moose Deer Point, the Mohawks of Wata, and the Georgian Bay, Moon River, and the Barrie South Simcoe Métis Councils in this region. The Huron-Wendat and the Haudenosaunee Confederacy have also walked on this territory over time. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into this covenant in the spirit of respect, peace, and friendship. Most of us have come here as settlers, immigrants, or newcomers in this generation or generations past. We are all treaty people.
I'm Adam, and I work as a public health nurse on the smoke-free program at the Simcoe-Muskoka District Health Unit.
And my name is Claire, and I'm also a public health nurse in the smoke-free program at the Simcoe-Muskoka District Health Unit. And together, we are representing the Provincial Non-Experiment Communication Work Group to provide you with this webinar. During this webinar today, we will be hosting a panel discussion with 3 of our featured guests. First is Tracy Burnett-Green, who has been working for the Simcoe-Muskoka District Health Unit for the past 17 years in both the Substance Misuse Prevention Program and the Smoke-Free Program. For the past 13 years, she has served as the Youth Engagement Advisor in the Smoke-Free Program, where the majority of her work now focuses on youth vaping prevention using Not an Experiment, including both local implementation and provincial collaboration. Next, we have Joanne Heisinger. Joanne is a public health nurse at Durham Region Health Department, bringing 18 years of expertise in the field of public health. In her current role, she serves as a Smoke-Free Ontario co-coordinator. She is part of the Healthy Living program, working with schools to implement health promotion strategies using a holistic and comprehensive school health model. She has a strong focus on implementing early interventions to tackle tobacco and vaping issues among community members, in particular, advocating for building capacity and education of our students involved in vaping incidences at school. And lastly, Sharon Munn. Sharon Munn graduated with a Bachelor of Science from the University of Guelph, a Master of Education from Nipissing University, and a Master of Public Health from the University of Alberta. She was an international science educator before joining Hamilton Public Health Services as a health promotion specialist. Her portfolio includes youth vaping prevention, and she uses principles of health promotion to prevent the initiation and escalation of youth vaping in the Hamilton community. Over our time this morning, we will discuss the need for vaping prevention in our communities, examine how Not an Experiment, or NAE, supports comprehensive vaping prevention in schools, learn how public health supports implementation of NAE, and hear from our 3 panelists on their experiences in collaborating with school partners in 3 different regions in Ontario. But before we dive in, we would like to know how knowledgeable you are in using Not an Experiment to support schools with a comprehensive approach to vaping prevention. And at this time, I would ask Kathy, can you please pull up poll number 1? So the question is, how knowledgeable are you in using Not an Experiment to support schools with a comprehensive approach to vaping prevention? And there's 30 seconds to fill out the poll. The answers are, I'm not knowledgeable at all, I'm somewhat knowledgeable, I'm knowledgeable, or I'm very knowledgeable. Perfect. We appreciate your input and hope that by the end of the webinar, you will have all of the knowledge and confidence to support your schools.
Thank you, Claire. As it is widely known, the tobacco industry has a well-documented history of lying about the hazardous effects of their products and employing questionable marketing tactics to target vulnerable populations, particularly our youth. Their marketing strategies aim to convince young people that their products are safe, fun, helpful, and even a normal part of life. Unfortunately, these tactics have led numerous young people to experiment with and become addicted to their products. Now that smoking rates for youth are at an all-time low, the industry is happy to pivot to a new product, continuing to use flavors, celebrity endorsements, advertising, and much more to addict a whole new generation to nicotine. The industry is aware that vaping appeals to young people who may not have otherwise tried smoking traditional cigarettes. Their goal is to create lifelong customers and consider it a victory when young people start and continue to do so or transition from vaping to smoking. According to the 2021-2022 Canadian Student Tobacco, Alcohol and Drug Survey, Canada has some of the highest teen vaping rates in the world, with 29% of students in grades 7 to 12 reporting having tried an e-cigarette, and 12% of students in grade 10 to 12 vaping daily. The prevalence of youth who are not only trying vaping, but using it daily is concerning. The brain of a young person keeps developing until the age of 25. If a young person vapes nicotine, it can negatively impact their cognitive function, memory, and decision-making abilities. This may also make their brain more vulnerable to other forms of addiction in the future. Many people believe that vaping nicotine can help them relieve stress or anxiety. However, the opposite is true. Vaping nicotine can increase stress, anxiety, and depression. Apart from the mental health effects, vaping can also cause physical health problems, such as increased heart rate, lung disease, chronic bronchitis, and insulin resistance.
We know that the industry is doing its best to attract youth to vaping. Together, we can fight back and educate youth about the dangers of vaping using Not an Experiment. This health promotion program offers resources and downloadable materials via a program website, www.nonexperiment.ca, to support public health and education partners in implementing a comprehensive school-based approach to prevent and reduce youth vaping. These resources and materials help to address topics such as how vaping nicotine affects the body and mental health, how youth can resist the pressures to vape, how schools can prevent vaping in school washrooms, how to engage parents and other caring adults, how to provide support for youth looking to quit, and other general information including health effects, stats, and the law. Recently, Dr. Kieran Moore recognized in the Chief Medical Officer of Health annual report that Not an Experiment is an effective and promising intervention that will influence the drivers of substance use, reduce harm, and help prevent youth vaping. We are thrilled to see this recognition from the Ontario's Chief Medical Officer of Health and are so eager to continue supporting youth in the province. Continuing to speak provincially, data collected from the Not an Experiment Provincial Reach Tracker shows that between January and December of 2023, 98% of health units implemented Not an Experiment. These activities were either done locally or as part of a single or multi-tobacco control area network, multi-health unit, or provincial collaboration. When we take a closer look, we see that 96% of activities that involved youth or adults were implemented in a school setting, with 80% being facilitated by health units. The estimated number of attendees present during these activities are as follows: over 7,000 grade 7s and 8s, over 9,000 grade 9s and 10s, almost 7,500 grade 11s and 12s, and over 2,000 adults 18 or older. So now that we've discussed the need for vaping prevention in our communities and reviewed some examples of how Not an Experiment supports this, let's hear from our three panelists on their experiences in collaborating with school partners. First of all, we would like to thank you all for being here with us today, and we are excited to learn more about how each of your health units work with Not an Experiment to implement vaping prevention in your communities. And so to begin our first question, and this question is for Joanne and Tracy, with Joanne going first. Was school board approval required to implement the NAE program in schools? And how did your health unit contact local school boards to get this approval?
Thank you, Claire and Adam. Can you guys hear me?
Absolutely.
Okay, great. So yes, these Not an Experiment needed to be school board approved. And at Durham Region, we'd use a coordinated approach for school board approvals. Our health department has a liaison within the school boards, and for all our programs to submit their resources and materials. And so when there are new resources and materials that are needed for approval, we submit to our liaison, who will then submit them electronically every month. Thank you.
Okay, so similar to Joanne's health unit, we here at Simcoe Muskoka District Health Unit always need school board approval before introducing a new program or resource to any of our schools. So in order to do that, we have a school health program team in place, and they act as sort of the liaisons between the health unit and the boards. So our smoke-free program team is required to complete a planning tool document for any new initiatives that we wish to roll out in schools. And then the school health team then uses that document to take the initiative to the boards for approval. So once it is approved by our boards, we are then able to actively promote and use the initiative within schools. Our smoke-free program team then completes an annual review of our approved programs and resources for the school health team so that we can provide information about any new additions or updates. And then the school health team can then decide, does this need new approval at the board level? Or as is most of the case, it's just sort of an FYI, here's what is new in this already approved resource. And that is our process.
That's great. As public health, we commit to the well-being of our communities, and part of this is supporting schools and addressing youth vaping. So it's quite helpful to hear how your different health units brought Not an Experiment to their respective boards for approval. Thank you so much. So the next question is for Sharon and Joanne, starting with you, Sharon. How are the rules of implementing Not an Experiment determined in your health unit? And are there different responsibilities laid out for health unit staff and educators?
Thanks, Adam. So in Hamilton, health promotion specialists like myself are responsible for sharing Not an Experiment materials with our school program public health nurses. So we do that to increase their awareness of the program and so that they know what resources are available. Every fall, we offer an optional hands-on capacity building session that includes Not an Experiment materials in order to increase PHN confidence in implementing the activities. So for example, 2 years ago, we actually played the paper version of the Escape the Experiment game. And this past year, we displayed all of the health communication activities and materials and reviewed all of the new content that was available on the webpage, such as mental health. We also share new resources as they become available. So we have a shared drive where I would put the new resources and then send out an email noticing so that they would note that they were available. The public health nurses are the ones who interact directly with the schools. So then they would come back to me for a consultation if needed about what resource would be the best fit for the appropriate and intended use and outcome. And then our PHNs will work with the schools and educators to determine the best implementation plan with the ultimate goal of building capacity and confidence in the educators themselves so that they would be the ones implementing the program. Thanks.
Absolutely great. And then Joanne.
Thank you. Similar to what Sharon has expressed, all our nurses in the Healthy Living program are trained on how to facilitate Not an Experiment and work with the schools to implement its content. There are no specific rules laid out for our staff and educators when implementing these activities. It's really up to the nurse and the school to decide how to implement non-experiment and who will take on those roles. But ultimately, as Sharon had also pointed out, it's building capacity within the schools. Thank you.
Thank you, Joanne, and thank you, Sharon, for sharing this information about the different roles. It's so nice to hear the different collaborative approaches between a health promotion specialist and a public health nurse, and between a public health nurse and the school. And so for the questions going forward, we will hear from all panelists. So the third question is, please describe the role that the health unit staff play in promoting or supporting the implementation of Not an Experiment. And the order is Tracy, then Joanne, and then Sharon.
Thanks, Claire. So various team members and health unit staff play a role in promoting and supporting the implementation of Not an Experiment here in Simcoe Muskoka. So first we have our school health team. They make schools aware that the program exists during their initial school outreach visits that take place usually at the beginning of the school year. And in order to help them do that, our smoke-free program provides them with key messages that helps them speak to vaping as a priority public health issue and how the health unit can support them via our Not an Experiment program. As well, our tobacco enforcement officers are very willing and able to speak about Not an Experiment, and they actively promote it when they are in schools handling enforcement issues. They do recognize the importance of prevention as well as those enforcement pieces. Information about vaping and Not an Experiment is also available on our Simcoe Muskoka District Health Unit website, specifically on the school health team website, which is sort of the go-to spot for school administrators when they're looking for support and services from the health unit. We've also done broader communication with schools, such as sending every single grade 7 and 8 teacher in our board a very eye-catching, never-ending card resource. And all the schools in Simcoe Muskoka this past year also received a table tent resource. Both of those things highlight Not an Experiment and vaping as a priority public health topic. We've also sent board-wide emails to help raise awareness about Not an Experiment, and we've done paid social media ads that target educators specifically here in Simcoe Muskoka. So once the school is aware of the program, they can request our support either through our school health nurse or by email or phone. And once that happens, the request for service makes its way to the smoke-free program team, and a team member will then facilitate the planning of the activities in partnership with that school. So in past years, we actually led the facilitation of the Escape the Experiment game. But really, we felt that it resulted in the schools treating it more like just a one-off event, and that comprehensive implementation of the entire program wasn't happening as often. And also, just from a capacity standpoint, our team had a really difficult time keeping up with the demand. We are a mighty team, but we are a small team. So this year we knew we had to pivot, and we changed our approach to build more capacity within each school so that they can deliver not only the game, but the whole NAE program themselves. So to do that, we created loaner kits for the Escape the Experiment game. And then those kits contain all the materials needed to run the game, included detailed facilitation instructions, as well as copies of the resources, such as the posters, the announcements, etc., that will then hopefully extend the reach beyond just the classroom who are completing the game. We also offer to meet with educators if they feel they want further facilitation instructions. And honestly, we do get schools that request that, but more often than not, they look at what we send them and they say, no, we got this, and we're good. And that is how we handle it.
Thanks, Tracy. Joanne?
Okay, so with Durham Region, we have an assigned nurse to every school, publicly funded school here in Durham Region, that worked with the schools to assess and identify needs of the school using a comprehensive school approach. So we do this by reviewing school climate surveys, school improvement plans, attending meetings with school staff, and if identified as a need for the school, our nurses will implement promote non-experiment to their school as a part of the Healthy School Action Plan. How we implement, again, non-experiment in our schools varies on what the school needs, wants, and structures are. And our nurses work closely with their school to determine the best approach, and which can range from, and Tracy already identified many of those, train the trainer sessions for school staff and student leaders to allow them to run the activities, provide content resources, whether print or digital, and provide support for curriculum. Um, we try to be very creative with our schools, so uh, the way we run things are very case by case basis, and really looking for the best approach for our individual schools. We also, as Tracy pointed out, we have information available on our website that educators can go to peruse what we have available, and also to contact their public health nurse. Thank you.
Perfect.
Thanks. And similar to both Tracy and Joanne, Hamilton Public Health Services does many of the same things. So we also promote non-experiment within our Healthy Schools website. And we have our school team, our school program public health nurses who support specific schools in Hamilton. And if vaping is a school identified priority, then we would support them in implementation of not an experiment. So I'll provide some examples of how we've done this in the past. We've had PHN facilitated activities where the public health nurse is facilitating. They may engage students directly to design a bulletin board using not an experiment health communication materials, or working with the students to read the school announcements. We've done a 3 or 4 corners activity using not an experiment website content to develop the questions for that activity. We've also co-facilitated with educators. So myself and another public health nurse were able to work with a school's health action teacher to facilitate the Escape the Experiment game with all the grade 7s and 8s in a school. And we implemented the Take the Clouds Outside activity with the school's health action team. So all the students that were involved in that. And we also do, like Joanne was saying, work with students directly to support implementation or peer-led facilitation. So recently, a local high school, we had HAT students or Health Action Team students lead stations during a vaping prevention event. So we had a cessation station where a student was there. We had the poster, the cessation app info and tear pads. We had a Take the Clouds Outside graffiti board. So we set it up with craft paper and markers, and the students used website content to develop their messaging. And we had one student acting as the trivia leader for a giant Connect 4 game where we used the questions, the true and false questions that are within the grade 7 and 8 lesson plans to run some trivia. So in summary, there's varied ways to implement not an experiment depending on the school needs.
Wow, that's amazing. All of you, it sounds like definitely the health unit staff, our role is to closely work with each school one-on-one to identify their need and the most appropriate resources supporting their needs by meeting them where they're at, really. That's great. So our next question, again, will be for everyone in the order of Joanne, Tracy, and then Sharon. And this question is, how does your health unit encourage schools to implement NAE or not an experiment comprehensively? In other words, using most, if not all, applicable resources.
Mm-hmm. Thank you. So for Durham Region Health Department, we do encourage schools to implement non-experiment with their assigned nurses in a comprehensive school approach with consistent messaging, targeting the various audiences. So looking at staff, looking at students, school communities. And we do this through attending staff meetings to build awareness and education, and working with student leaders or student HAT teams, as Sharon had said, and working with the school council meetings. We also encourage schools to use planned events to promote and build awareness with their school community. So looking at professional development days for their staff, looking at school family family events like parent interview nights, welcome to school barbecues, using their social media platforms to continue the messaging and ensuring that there is proper signage. So pulling in our tobacco enforcement officers to provide information about signage and questions about the Smoke-Free Ontario Act. So that's that in a nutshell.
That's great. And Tracy?
Thank you. So yes, we really just try and make the whole process and the whole implementation as easy as possible for schools. So as I spoke to earlier, we do things like provide program training to educators and administrators to describe what a comprehensive implementation of NAE could look like in their school. Just little things like if we're communicating via email with schools, we provide links directly in the website, right to the website. So, or directly in the email, right to the website. So they can just click through right away and they don't have to go back and they don't have to go searching for things. We provide all of the printed resources free of cost to the schools. So that's not a barrier. We provide loaner kits like we've been talking about for the escape room game. And again, it's similar to what the other presenters have said. We do offer presentations at either staff meetings and or to parent council groups so that it's not just students receiving the message, it's also teachers, it's also parents. The second thing that we do, we really try and explain to schools that vaping is a complex issue. Behavior change is a process, and that raising people's awareness and understanding to vaping as a priority health issue is really just the first step in creating this change. So we will say to them that students and parents and school communities at large need to hear vaping related messages multiple times from multiple sources in multiple ways. In order for that change to begin. So by doing this, it really helps to build that understanding that completing just one-off activities isn't going to move the needle, and that a comprehensive health promotion approach is best practice to reduce youth vaping. The third thing we do is we offer to partner with our school boards to update existing policies and to help create vaping specific protocols. So far, one of our school boards has taken us up on this offer, and together we've been able to create a protocol that explains the importance of using a comprehensive approach to address vaping, while outlining how not an experiment can be implemented in the schools in a comprehensive way. It describes the roles of various stakeholders as well. So that includes, what school boards are responsible for doing, what school administrators are responsible for doing, what the educators are responsible for doing, and what the health unit's role in supporting all of that is. So this protocol with this one board is set to roll out in the fall. So we're really excited to see and find out how what the results of that are going to be.
Absolutely, that will be exciting. And then finally, Sharon.
Thanks. So similar to Joanne, in Hamilton, we try to engage multiple audiences within our schools. And as Tracy was just talking about, we also have protocol with both of our public and Catholic school boards as well, outlining responsibilities so that it is a whole team approach. So when I'm working directly with our school program public health nurses, I often would suggest a week-long program or implementation within a school. So it isn't just a one-off lesson or activity. Depending on the school needs, I might outline suggested activities by audience. So here's something to do with educators, something for parents and caregivers, something for students, or by activity. So if it's a whole school activity or event versus individual classrooms or the health action team. For example, if a grade 7 or 8 class was implementing the game, we might also suggest that the school announcements run in the week leading up to the game, that the health action team set up some posters around the school and the washroom posters, and that we deliver the tear pads to the counselors and student success teachers, as well as the newsletter insert going on the school blog that week. So just to make sure it's reaching a variety of audiences. Last year in Hamilton, for parents and caregivers, we adopted the Not an Experiment parent resource to include contact information for one of our local substance misuse agencies. And so this resource was shared at back to school evenings and parent events directly with parents and caregivers. I also promoted the Not an Experiment Parents webpage during our two school board parent events last year in the fall. And just going outside of schools a little bit, in the Central West TCAN region, we also ran a social media campaign directed to parents and caregivers last year using the Let's Talk About Vaping video series. So this was targeted social media ads to parents and caregivers on platforms used by their demographic, so mostly Facebook and Instagram. We had Cineplex pre-roll video ads before all of the movie previews, as well as organic promotion through our health units in our region. And I'm hoping for the 2024-2025 school year to share vaping prevention resources within professional development sessions for our local school board educators. So at that point, we would also be highlighting various Not an Experiment resources.
That sounds great. Thank you all for going into detail about what a comprehensive approach looks like. Creating an individualized plan is definitely key to meeting the identified needs at the school. The next question is, what positive experiences or wins have local schools reported seeing after implementation of Not an Experiment? And the order is Joanne, then Sharon, and then Tracy.
Great. So we at Durham Region Health Department, we've seen many positive experiences working with our local schools. Just allowing our nurses to build rapport with the school community and our students. This has led to the schools taking on a more comprehensive approach with greater public health engagement, not only on this topic, but with other topics as well. Schools have reported that the interactive component was enjoyed by all students because it really uses different learning styles. So kinetic learners, auditory learners, visual learners, it touches all those points. It's a great leadership opportunity for older grades. So looking at student leadership and building capacity within the school body, and using critical thinking and deeper connections were made during the post-activity discussions. So the debrief after running the activity. The events were also showcased in many school board newsletters and their social media platforms. So it was taken in very positively. Thank you.
Yeah, so similar. Our schools are typically appreciative of any activities that we're willing to implement or support the implementation of. We've had appreciation from educators, from health action team teachers for various events and implementation that we've done in the schools. We've received invitations to return, which I think bodes well for us. So it's saying that they did engage with the content and enjoyed the activities that were planned. And we've also had reports of positive student engagement as well as informal positive feedback from educators as well.
I think our response is fairly similar. We've had lots of feedback and indications that the program's presence has been seen and heard. We've had a couple of media stories and stories in local newspapers after the events have happened. After learning about and using Not an Experiment, schools have identified new opportunities, again, very similar, such as using youth engagement, opportunities to train students, and to take the program to feeder elementary schools. And this is something that, we're all very excited about. It's very promising because when we were in the very early developmental stages of Not an Experiment, we really struggled to find students who wanted to speak out publicly against vaping. So we're really hoping that this is a sign that there's a shift occurring and we'll be able to use more of those youth engagement strategies in the future. Anecdotally, we've been told by schools who implemented Not an Experiment that they've seen less vaping inside the school. We've started to see a momentum build among parents who want to do something about this issue, especially after presenting to parent council groups. They get very fired up when they hear about the industry marketing tactics, etc. And we've had more than one group of parents say, okay, what do we do now? Like, what can we do about this? We're seeing more and more word of mouth between schools and teachers wanting to use the program because they've heard positive things about it from a colleague. And just again, anecdotally here, at one point here in Simcoe Muskoka back in the fall, for several weeks, our team was actually receiving the equivalent of one request for service from a school every single business day. So that's huge here. So very excited. Very excited.
That is all very exciting, and we are so happy to hear about all the positive experiences shared and the impact that non-experiment has had so far among all these audiences. And so that brings us to our final question for all of our panelists, starting with Sharon, Tracy, and then Joanne. So what lessons have been learned from implementing Not an Experiment in schools, and what is your health unit's future direction based on these learnings?
Thanks, Adam. So as a former educator, I think one of my biggest learnings has been that there's the ability to adapt and modify not an experiment activities in a way that meets a school's need. So for example, maybe not having the materials or time to set up the Take the Clouds Outside activity, but we've done it in two different ways where we at one school did chalk clouds outside on the whole walkway up to school. So again, generating conversation as students and parents and caregivers are coming to school. The graffiti wall example with craft paper and markers. So there's various ways to implement the activity depending on your resources, your capacity, your time, and things like that. We've had success with the in-person Escape the Experiment game, as well as modified versions of the Take the Clouds, like I just said. And we've really learned that the comprehensive approach is better than a one-off activity. So we try to promote the resources and materials in that way. Our health unit's future direction based on this is that we're excited to see upcoming results of the Not an Experiment evaluation. We will continue using and promoting the resources within our schools. And I will continue to sit on and contribute to the provincial work groups on the creation of these resources and communication campaigns in the upcoming year. Thanks.
Amazing, thank you. Tracy?
So similar to what Sharon just spoke of, our lessons learned include that the comprehensive approach is the way to go, and we encourage it every opportunity we get, while at the same time being prepared to meet schools where they are at and pivot and adapt as needed. We've also learned that building capacity among educators to deliver the program really does work. We were very well, I won't say all of us, some of us were very skeptical that handing it off to the teachers was going to work, but we've learned that teachers are very capable and many are very excited to do Not an Experiment because it is a fun and interactive program. They know that once they see it, they know their students are going to enjoy it. And so they're willing to roll with it. We also learned that school board support is essential and consistent direction from them to their schools in terms of creating a protocol and making sure policies are up to date goes a long way at getting school buy-in. So definitely worth the time it takes to work with the boards. Our future directions just include continuing to build school capacity using the NAE platform, including the website, the education resources, and the game kits. And again, as Sharon mentioned, we are also looking forward to getting the evaluation results so that can help guide our next steps in terms of updates and additions and future direction of Not an Experiment.
Great, thank you so much, Tracy. And Joanne?
And just to echo what my colleagues have already spoken about, taking the time to coordinate and plan with schools to ensure it runs smoothly with multiple groups or classes. So making multiple meetings with schools and student leaders to go over information and to help build their capacity and their comfort with the activities. one thing that we have learned is that post-activity class discussion that is included on Not an Experiment has been very important and crucial to the learning, the deeper learning for students. They really like to debrief after running the activity, the student leaders and the classes that they are promoting the activity to. So having more of that deeper discussion and pulling out information that they may want to look for comprehensively in the future. Um, Also having the different versions, so being flexible how you run the activity with large groups or in a shortened versions to work within the time constraints of the school has been very beneficial. And just as Tracy had mentioned, it's beneficial to have that school champion, that person within the school, the walls of the school, really take the lead, whether it's school admin or a teacher, to really support this work in the schools. Our future directions and learnings is just to continue to promote non-experiment with our schools via social media or with other community or school events. Continue to maintain kits. So we do have physical kits that are used in schools, ensuring the kits are up to date and organized. And again, looking for opportunities to do board-wide promotion of non-experiment through professional development day venues with each school board to ensure teachers are aware of the activity and how they can work with their schools. And similar to both what my colleagues had said, looking at the evaluation that comes from Not an Experiment to plan our next steps moving forward. Thank you.
Thank you so much. These are all fantastic learnings. And like you said, the evaluation is really going to point us in the right direction, but also your feedback is valuable. And so keep up with it. It helps us shape and adapt non-experiment to continue to meet the needs of our community. So I just want to thank all panelists for representing your health unit today and for providing your key insights into how non-experiment is implemented in your communities. And audience, if you have any questions for our panelists, please write them into the chat, including which panelist the question is for, and we will discuss them at our Q&A session coming up shortly. I'm just going to jump back into our PowerPoint for everyone here. Claire, we can see everything here?
Yep.
Perfect. Okay, so well, as we've just heard, there are lots of boots on the ground promotion done to communicate non-experiment to schools and educators. However, just as the industry takes advantage of all sorts of advertising, we too have other opportunities to spread awareness about the dangers of vaping in our communities. These opportunities can come through both local and regional avenues. One example is a billboard advertising, such as the one you see on your left. The graphic was displayed as a rink board in the Bayshore Community Center, home of the Owen Sound Attack OHL team, to dispel a popular myth and promote the Not an Experiment website. A second and key opportunity is social media. We can reach and educate critical populations in our fight against youth vaping through ads like the ones you see on the right, which inform parents and other caring adults on social supply and the importance of talking about vaping with their children. Other opportunities can include conferences, presentations for adult champions like parents and community clubs, and policy work. So before we wrap up today's webinar, we would like to take a moment to reassess your knowledge in using Not an Experiment to support schools with a comprehensive approach to vaping prevention. So this time I'd ask that, Kathy, could you please send out the second poll? So after attending today's webinar, how knowledgeable are you in using Not an Experiment to support schools with a comprehensive approach to vaping prevention? We'll leave this up for about 30 seconds. Okay, that's great. Thank you again for put, it's no surprise that on young people's lives. As you heard today, Not an Experiment is a versatile tool that can be used to educate and spread messaging about vaping to our schools and our communities. It will take a collaborative effort to implement vaping prevention in our communities. Please continue to have these important conversations with your schools, community stakeholders, and families. Together, we can make a difference and help stop another generation from becoming addicted to nicotine. And with that, we would like to thank you for your attention and I hope that you found value in today's presentation. Once again, I would like to thank our panelists for their participation this morning and will now open the floor to questions. If you have not already done so, please write any. If your question is directed towards one of the panelists, please indicate the name of the panelist you wish to ask your question.
Thing that you can share.
So the protocol, and Adam, you can jump in on this one because you were involved with that, but it is just finalized, if I'm correct, Adam. And so I believe what the board had said was if once it was finalized, they would be okay with it being shared, across Muskoka. So I don't see why that wouldn't include a more provincial share, but we can just, verify that and make sure that that's okay with them. But I don't see that being a problem. I'm sure they would be happy with it being shared. If you agree with that, Adam.
That's my understanding as well. So as soon as they have, we've heard back that it's finalized, and we confirm that it's going to be shared provincially. But they seem to be very excited to have it out there and to let other people take a look. Thanks, Tracy. So our next question: did anyone do a more formal evaluation?
Similar to what Sharon was saying, it's the physical person resource. So having the time to fulfill the requests with schools, and we get so busy here in Durham region with multiple requests. So having that, it's always like a shifting landscape of our resource availability. And a good problem is that we do have physical kits, and sometimes a little bit of a struggle or a challenge to find an available kit to use in a school. So that's a good challenge, and we're trying to look for opportunities to alleviate that. I think personally, one challenge has been sometimes there's the rotation of school admin staff. So that educator champion that I was speaking about, when they get rotated out to another school and you've lost that momentum a little bit, it's almost you take two steps back to rebuild that rapport, to establish working on the activities for that school. Thanks.
Perfect. Thank you so much.
Okay, so our next question is there a set presentation for Not an Experiment, and where can we access the in-person kit for the paper version of the game if still available? So you go ahead. Yeah, go ahead, Tracy.
No, it's okay. Whatever. I will just say, so there is a PowerPoint presentation available on Not an Experiment on the educator page. I will preface that with two things. The first one being we are in the middle of updating that PowerPoint presentation. So in the coming weeks, our provincial content Not an Experiment work group, we're just finalizing changes to that presentation right now to get it updated. So it will be changing what's there currently. The second thing I will preface that with, though, is that we really do intend for that PowerPoint presentation to be for an adult audience. So it's something that you use to educate your teachers in your schools. It's something you use to educate your parents with. For your schools. We do not recommend that is a PowerPoint presentation that gets presented to students themselves. One, just because it's boring. Like the whole point of non-experiment is for it to be fun, to be interactive, to get them up and get them learning in a different way. And the PowerPoint presentation does not do that. And second, there's information in that PowerPoint presentation that I wouldn't necessarily share with students. One, because they probably already know that information. But we don't also want to come across as advertising vapes and e-liquid. Students don't need to be taught that, where parents and educators maybe do. So that type of information is in that PowerPoint. We do not recommend that that is the angle you take with youth. So that's my 2 cents there. And what was the second part of that one?
Access to an in-person kit. So maybe the loaner kits are they're talking about.
Yeah, so we've had emails to our non-experiment inbox asking for, what are the contents of a loaner kit, and so that is something we can provide to anybody that is curious. They can either email Adam or Claire or myself, or just the general NA inbox, and we can provide you sort of just with a general list of what we've included in our loaner kit that you can go off of.
Perfect. The next question is a request to send out a copy of the presentation. So the file for the PowerPoint is quite large. I believe for part 1, we saved it on the SharePoint. If you do not have access to SharePoint, we can send it through a secure file transfer. We'll put our emails in the chat, Adam and I, at the end, and you can receive it that way. And just a reminder that this presentation was recorded. And so in the next coming days, it will be uploaded to the Central East Tobacco Control Area Network YouTube page as well.
Which we can link here as well for those who might not have it. So we can do that. And then the next question is, are you able to share info about any new NAE resources that are in development? I feel like this is a good one for you, Tracy.
Absolutely. So as I just mentioned, we are in the process. This is sits at our provincial non-experiment content work group level. And that group is just in the final stages of updating the PowerPoint presentation that's on the educator page. We also have some plans for just changing the look of that educator page. We've received feedback that it may be just a little too scrolly for an adult audience. So we're kind of looking at how we can change the look of that page just to make it a little bit more user-friendly. Aside from that, we don't have any plans for any new immediate resources that I can think of off the top of my head, mostly because, again, we're just in that final stages of waiting for that evaluation for those results to come back to us. So we really want to use those evaluation results to inform what our next steps, including perhaps, what resources need to be added or rejigged if that is a thing, to the website. So once we get those evaluation results, we'll be taking a deep dive into those and looking at what potentially we need to do to update non-experiment or make additions.
Thanks, Tracy. And then there was a part 2. So this is for all and any and all panelists here. So for panel members who have presented to parents/school councils, when you say they get fired up and ask, what can we do? What advice do you give them?
I'm happy to start that one as well. I don't know
Sure.
if Sharon and Joanne have had the same similar experience, but at this point, it's a touchy subject. We know that we're not allowed to do any sort of direct advocacy to government. So that is not something, we can be involved in, but perhaps there is a way to get these parent groups involved in that we can take a back seat to. We don't have a perfectly planned out thoughts or ideas for that. We try and do a little bit of planning and development work in the summertime when we have, the benefit of having a student around. So it's on the list of perhaps things that that a student can perhaps help us develop, but no guarantees yet. But basically, we have to let them know that you know, this is an industry that is targeting kids, period. Like full stop. And we share examples of what happened with tobacco control and how groups got involved and said, like, no, we're standing up to this industry, and various ways that that happened when tobacco control, back in those days, and say, like, these are the types of things that we predict need to happen in order to get vaping under control. So yeah, it's information sharing at this point. It's letting them know that these are the types of things that happened, that we need to let, local members of parliament know that they're not happy as a parent group. And then hopefully over time we can sort of look at a more organized collective approach.
Oh, go ahead, Joanne.
Go ahead.
You can go first.
Okay, sorry. And just to add to what Tracy was saying, looking at the parents, the caregivers, as being the first teachers, being the one that can bring communication or continue communication at home. So the Not an Experiment Parent Guardian resource is a fantastic resource for parents to use to keep the lines of communication open, not just with vaping, but with everything else. As children transition to high school, looking at those refusal skills, how doing the role playing scenarios. So looking at starting at home and then working way out this information, and they're usually really shocked about the stats, how many kids are vaping and what are the ages of the kids that are vaping. So just continue to really promote communication at home as children go to school. Thanks.
Thanks, Joanne. My response was very similar. Within Hamilton, we normally start out by sharing our local OSDIS data, so our stats on youth vaping within our own city. And then last year, my presentations were really focused on communication between parents and caregivers and their child, how it's not a one-off conversation. It's ongoing. It can start young. We referred to the parents page as to help build the knowledge within parents and caregivers themselves so that they feel comfortable talking about these topics, and then giving them tips about how and where and when you can have these conversations with children. We also invited in some youth who had vaped and had successfully quit vaping, and they were able to share their stories and give some youth voice with lived experience. And they were able to share what helped when their parents were like supporting them, what helped and what didn't help. So to give some examples of what parents and caregivers could do. And we recorded the session so that parents for parent councils and schools could share this after the event to reach more parents in our community as well. So really just supporting parents in how to start these conversations and how to have them on an ongoing basis with their children.
Great. I am noticing there are a couple questions posted in the Q&A section. So there is a question, it's for everyone. If you had to sell NAE in a few sentences, what would you say? And the attendee is looking for pointers as she is a new school PHN.
Honestly, I would say that in a few words, I've never been my strong point. Dynamic, interactive, engaging, comprehensive, health promotion program. And it's worth looking at.
Yeah, I was going to say something similar, easy to use. There's many components of it, and it can be geared towards any audience, really. Yeah. And there's another question in the Q&A. How many students is an ideal number of participants? So for the game, I know we talked about the loaner kits and in-person game. It can really be done in any type of group. We've done it in groups of small as 5 to 10, or on a large scale up to 100 to 120. So anything we do, the students usually work in groups. So the groups can be as small or as big as you can. It just depends on how many facilitators you have. So obviously, if it's a bigger group, you'll need more facilitators or teachers, educators, staff that way. So there's really no ideal number, as many as we can get. Or there's different, they can be run in different periods, different sessions, classroom by classroom, anything like that.
Okay, we have another one here in the chat. Does anyone know if the vape industry has used some PR agency as big tobacco or big oil to promote their use?
I can say that I don't know the answer to that question specifically, but I can say that we have seen ads that are literally duplicates of old tobacco cigarette ads. And in fact, I'm doing a presentation next week where I'm showing, like, here's a 1970s tobacco print ad, and here is the 2000s updated version where literally all that's changed is the clothes, the haircut, and instead of holding a cigarette, they're holding an e-cigarette. So if they're not using the same companies, they're definitely using the same strategies.
Thanks, Tracy. And aside from being addictive, are there other concerns with nicotine? So nicotine is one of those things that, other than the addictive property, that is part of it. That's what kind of has them keep coming to use the product, but it can lead to other forms of addiction. They've started to find opening up gateways to use and be a part of other risky behaviors. There's things that obviously we're concerned about with mental health and the just the function and development of a youth brain. So there are certain things that nicotine, other than being addictive, it's a chemical, it's a drug that does affect various aspects of the body, and we have to keep that in mind, especially for youth.
And I do see one more question in the Q&A. Any tips to harness the attention span of youth, especially during PowerPoint presentation part of NAE? So as Tracy mentioned before, the PowerPoint is specifically for adult champions and educators to use as more as to gain information about vaping. For youth, we really recommend the other non-experiment resources such as the in-person game. There's the online version of the game. There's a very interactive Take the Clouds Outside activity. There's grade 7 and 8 curriculum and lessons plans on the website, posters, announcements. So we really encourage schools to use all of these things instead of the PowerPoint presentation.
Is there plans to include information about vaping, cannabis, or THC and NAE resources in the future? Many youth are vaping cannabis, not just nicotine. Thank you in advance.
At this time, as Cindy mentioned before, vaping cannabis is not included on Not an Experiment. And Sharon mentioned that the PHO and OTRU, have webinars that highlight the health effects of nicotine. So at this time, NAE is focusing on vaping nicotine. I believe that's all of the questions. Thank you all so much for submitting your questions. So at this time, we do conclude. Oh, yeah, Cindy?
I was just going to weigh in on the whole vaping of cannabis, because it wouldn't be just, it's not just as simple as speaking to vaping cannabis. it hasn't come through as a need to add to the site from people yet, or I don't know if it's been mentioned in the evaluation, but you would have to look at how we've referred to the health effects. They all relate to nicotine. So it becomes it's not just a simple change to not an experiment and how it's handled. So it's not to say that I'm not sure how that would be done. So if people have ideas about that, certainly share it at Not an Experiment website. But we have not looked into it at this point because of those complications.
Thank you, Cindy. So yeah, so if anyone wishes to weigh in and has some ideas or anything, you can reach out to nonexperiment@smdhu.org as well, or that's probably a great place because it comes right to us. And other than that, I don't see anything else. Do you, Claire?
Nope, I think we're good.
Okay, well, thank you so much for everyone who attended and for your attention today. We hope you found it of value. And again, we'd like to thank our panelists for joining us today and enlightening us with the information they have. So thank you so much. Take care. And again, this was a recorded session, so it will be available and we will be able to share the PowerPoint slides. Thank you so much, everybody.
Thank you.